Ide-cel is one of the CAR T product that has probably the largest study and is probably the one likely to get approved first. It's a BCMA targeting CAR T cells, and number of studies have been done, but the largest study called KarMMa-1 study, which has been presented at ASCO, it shows basically its very high effectiveness. So all patients, 73% response rate at the target dose of 450 million cells, the response rate was 82%. And the responses are deep, meaning patients get MRD negativity. For example, patients who get VGPR, 48% of the patients at the target dose achieve MRD negativity. And the PFS is 8.8 months, but it's 20 months in people who get CR. So there are deep responses and to some extent durable responses. And the toxicity is reasonably tolerable, except almost 90+% patients get CRS, usually of grade 1 or 2, only 6% grade 3. So, and this is in a very advanced patient population, patients who have had 6 median lines of treatment. Now, as we are getting good responses, another important component of CAR T is how are patients feeling, because that's very, very important in these days. And so to understand that, we had performed what is called quality of life analysis. So before treatment, during and after treatment, using these various tools which are available, we can judge patients' quality of life. Is the treatment making patients better or are causing more problem? So doing HRQoL is a very important component of all oncologic treatment now. So a primary quality of life domains such as fatigue and how patients' general health is, were all very positive and were presented previously. But in this ASH, we had done secondary quality of life domains in these relapse refractory patients. And this is where one would look at various other subdomains which are important using tools such as QLQC30 by EORTC, EQ5D, 5L, and they look at more secondary factors. And what we did was we combined with the baseline and looked at emotional functioning, social functioning, role functioning, this patient population. And these are all very important day-to-day characteristics the patients may have during the study. And importantly, what we reported is that all of this, role functioning, emotional and social functioning, significantly improved during the treatment from the baseline. And if you look at some of the side effects related areas such as nausea, vomiting, constipation, diarrhea, insomnia, dyspnea, appetite loss, they all decrease during the treatment. And so the summary of presentation was that as patients are getting responses, their PFS is increasing, their quality of life seems to be improving. We have to look at their persistence, but in this study with whatever follow-up we had, improvement in quality of life does persist with patients having responses. And so that's a very important aspect for these CAR T cells. Now, I would like to highlight that there are other CAR T cell products also being discussed, as you asked. There are 2 other studies which are at an advanced stage, and there are multiple other CAR T products presented at ASH as well. They are all predominantly BCMA targeting. And the 2 other large ones, one is called Ide-cel, where a large patient population data was presented at this ASH. Another one is Orva-cel. Both of them shows very similar pattern. High response rate, anywhere from 75 to 95%. Good tolerability with cytokine release syndrome in predominantly all patients, but of lower degree, grade 1 and 2, and also showing that neurotoxicity, which ends up being an important factor in lymphoma, is not a major issue here. It's observed in between 15 and 20% of the patient population. Actually, cytopenia, because of the lymphodepletion, is probably the commonest side effect that we observe. So that is the general sense, extremely effective, well tolerated, and they will become our standard of care as soon as these are approved. And we are hoping that one, if not two, of the CAR-T products might become available within next year. Just a side note, in this ASH we presented data. We are beginning to study why do patients relapse from CAR-T cells and or will they respond to retreatment? And there was one interesting presentation from our group, which looked at only one patient, so it's an anecdotal thing. But we report that in this particular patient who had a good response to initial CAR-T had no response to reinfusion. And we found that this patient had a biallelic loss of BCMA locus. So patient's myeloma cell had lost BCMA, so it was not a target anymore and did not respond to the retreatment. Now, this occurrence is infrequent as far as we know right now. There are only anecdotal cases reported. We need to search for other possible causes of resistance and also relapse. But biallelic loss could happen in this patient population.